Hi, all. My name is Celeste, and I will be sharing my research on my future career path. This path is License in Family Therapy. I will be referring to it as LMFT for the rest because it's a big mouthful. I'm so interested in this career just because of my work in undergrad and my experience outside. Hearing the testimonials from other LMFTs has really painted a good view of what their normal day in life would be as a professional. I found it so interesting in school hearing about different interventions in healing and communication that I thought that would be perfect. It fits exactly what I want to do in the future as well. So, as I said, LMFT, it is a mental health professional who is licensed by the California Board of Behavioral Science, and their job is to create treatment for those struggling with mental health or emotional disorders within the context of marriage, family, and couples. So, duties really depend on what specific job you go into, but mostly they provide psychotherapy and counseling to individuals and families. The main goal is to strengthen interpersonal relationships and emotional well being. For me specifically, I want to go into one on one therapy discussing emotional and mental health issues such as depression, anxiety, and trauma. I find trauma so important just because it doesn't just affect the victim, it affects the whole system. And especially in the terms of marriage and family, children go through this trauma and they don't know how to cope with it, they don't know how to discuss it in a good way. So sometimes they need that help to just move through their trauma, acknowledge it, and understand it, and understand that it's not their fault. Many families and parents go through vicarious trauma where they don't know how to broach discussions on trauma moving forward or just other related issues. So I feel like it's an important topic, and I'm so excited to go into that field. Um, Other jobs include helping more couples with like communication and infidelity, helping the families with changes in their life like divorce and loss, or just another family member being added to the group. Can cause a lot of changes within the system. So it's important to go in and help them with their behavioral issues, developmental challenges that go along with changing demographics. My job would include treatment plans and keeping detailed records, not only for billing, but also to keep progress of the client's growth and achievements. I would also need to know about confidentiality and legal protections. One important thing I also would like to highlight is continued learning. So after you graduate, it's not just that's it and we move on. It is keeping informed of new therapeutic measures and techniques that could help the family system. Also being aware of tolerance and competence. So as I said earlier, you do need to graduate. So in order to become an LMFT, you have to get a master's degree in either marriage and family therapy, clinical psychology, counseling psychology, or social work. Now, going into a program like this, because I've applied a few times, I know now that you can go into one of these programs not even being an undergrad in psych. You could be going from science or math as long as you have some of the important coursework behind it. So that's 101 psych, that's abnormal psych, that's therapeutic measures, communication, and if you have and stats. If you have those, you can get into a lot of these programs. It's important in California to go to an accredited school because it'll later help you with licensure. And for licensure, you need practicum hours, which I'll talk a little bit more about later. Typically, these programs are 2 to 3 years, depending on coursework and practicum hours. Some of what they focus on is human development, family systems, counseling techniques, professional ethics and law, which is very important, and diagnosis and treatment. So, as I said earlier, practicum hours are very important because sometimes you can do those hours while you're in school, and sometimes you just do them after you graduate. So, that adds up to about 3,000 hours of supervised clinical experience that typically takes 2 years. Depending on when it's done. In California, we have to take the law and ethics exam and the clinical exam just to ensure your abilities in applying therapy and techniques in the real world. Annual pay depends on where you go, and these stats are taken from the U.S. Bureau of Labor Statistics from Indeed. So it's anywhere from $60,000 to $120,000 a year. That lower end is for your entry level, and that higher end is for private practice or other specialized areas. So medical benefits are varied depending on where you get into. Some of this information is taken offline. Some of this information is taken from my own job because there are LMFTs that work there. And a lot of places include comprehensive health insurance packages such as dental, medical, vision, and mental health programs. Same thing with retirement. It depends on where you go, where you work. My job offers 401k matching, paid vacation, sick leave, and professional liability insurance. I do not currently have all the skills and training to become an LMFT, but I do think I am empathetic and a good listener and somebody that can stay calm under pressure. Don't have that clinical hours, but hopefully in the future I can get that more educational qualifications to attain this degree, attain this job. Additional skills that I feel that are really important is knowing how to set boundaries and stay professional, as well as cultural competence. Just because, especially in LA, because I want to stay in LA, we work with many different peoples of many different backgrounds, identities, cultural influences. So it's important to understand our biases and how I may see things one way and a different culture sees it a different way, and understanding how to be flexible with the treatments that we know and how can we make this more available to other people. Documentation skills is also a really big one. I really want this job for many reasons. I find it so interesting but also rewarding to make actual change in people's life and affect them for the future. You know, a lot of people are held back by their experiences, and sometimes you just need somebody to guide you through your trauma or through the issues that you're struggling with. This job helps children and families, obviously, because I be doing therapy with both children and families, especially processing through trauma and behavioral issues. It's also giving parents age appropriate developmental expectations. You know, parents sometimes forget that it's not just a baby to a full grown person. You're raising somebody at a lot of different age levels. You know, you know them to an extent, and then a couple months later they're a different person. So being flexible, and that includes behavioral strategy, parenting strategies, and rebuilding connections. It's also talking about creating a healthy home life and environment for children to feel secure, understood, and gain a good attachment that will affect their future relationships. Overall, I think this job makes good change and really cares about the people, which I find myself to care very much. And it's change for future generations. You know, they say that to raise a child, you need a village. So I feel like becoming an LMFT and working with families to that extent really gains truth to that saying. Thank you guys for watching my video, and I hope you enjoyed.